Experts have described it as out of control. The current outbreak of Ebola is unprecedented. Health systems in the worst affected countries, Liberia, Guinea and Sierra Leone, have been brought down on their knees. And now foreign ministers from across Africa have come together to discuss a unified response. The decision by some of them to close their borders to citizens of the affected countries has been criticized.
This drive to protect is the proper response, but must be done in a manner that does not fuel isolation or lead to the stigmatization of victims, communities and countries.
Flight cancellations, border closures, and just the inability of communities to concentrate on their day-to-day activities is beginning to have an impact on the ground. The Africa Development Bank told the gathering here today that earlier projections of economic growth are beginning to go down by as much as 3%, and the situation could get worse if the Ebola spread is not checked.
We need to ratchet up the number of medical personnel. So we're asking our friends in the international community, even over a short-term period, to fly in medical personnel to assist. We need personal protective equipment. We also need a lot of logistics. We need coordination expertise.
The challenge is huge, but help is trickling in. The Africa Development Bank has provided $60 million, but that's only about a tenth of what the World Health Organization estimates is needed. Even then, Médecins Sans Frontières, one of the groups most active on the ground, has taken the unusual step of calling for military involvement. They say it is the only way to get the rapid reaction support that is needed.
We're going to have to get U.S. military assets just to set up, for example, isolation units and equipment there to provide security for public health workers surging from around the world. If we do that, then it's still going to be months before this problem is controllable in Africa.
More than 2,000 people have died in 5 West African countries. From the military cordon in Liberia to a 3-day lockdown in Sierra Leone, the outbreak has seen countries come up with radical measures to curb the spread of the disease, which shows no signs of abating.